Good afternoon and welcome to UMACO TV. My name is Kemal Erkan. Today is September 29th. And today is one of those episodes that we are going to have our clinical presentations. And I have Dr. Jennifer Liquido with me. Dr. Liquido is one of our pediatricians from United Medical Clinic. Dr. Liquido, how are you doing?
Hello, good afternoon. I'm doing well. How are you?
Very good. So this topic today is failure to launch. So this is more in the adult pediatrics, I guess, like older pediatrics.
Yes. Transitioning.
20s and 30s, early 30s, late 20s. So you are going to actually educate us in this. So this, if my understanding is, it's a new term, kind of like it's more and more it's happening. And then since we have a lot of pediatric population and United Medical Clinic is one of those practices where we have pediatric and adult medicine together, I guess you are probably seeing this more frequently and it's happening in the same practice. So we were thinking you would be the best person to educate us in this topic. So tell us what's happening with failure to launch.
Okay. It's actually a very, very interesting concept because we started seeing it in the practice before I see articles about it. So it's one of those things that, okay, we're trying to accommodate more of the young adults in the practice, all because of this shortages in provision of healthcare with lack of primary care people. So it's interesting that it's coming in the forefront. So it's not like the term failure to launch is not a clinical diagnosis yet. It actually came from a movie with Matthew McConaughey, and it became more of a phenomenon that people are seeing, and now people are paying attention and studying. You're going to allow me to share my screen?
Yes, you should be able
we can
to share.
talk about it a little bit more.
Yeah. You are able to share your screen, so go ahead. Yeah, we can see it.
Okay, so as I've said, it's not a formal diagnostic criteria. The first thing that is a criteria is it should not be a result of a developmental, mental, or an intellectual condition. So as I've said, like this is more of like the transitioning from being teenagers to being young adults. So you see it like, whenever I see kids who are in 10th grade, 11th grade, 12th grade, I ask them what their plans are, like what are they planning to do after high school. And you see kids more and more who don't know what to do. So that is one. Second, you see kids or young adults who start something like get a job or start college and then stop and stay not doing anything for a while, that like they're paralyzed, they don't know how to cope. So we see a little bit of this prior to the pandemic, but after the pandemic, there's just a lot more cases that we have started seeing. And again, we started seeing it in articles in the journal of not the journal, but in the pediatrics papers. So what we expect from the transition from teenager to adulthood, they should be actively getting engaged in activities of adulthood. So yeah, going to college or finding job. Like in this country, different in our culture, Kemal, I know that we see, after 18, they're expected to be living by themselves. And not being dependent on their parents. Like even those who are in college, they find jobs, they get their own loans to pay for college. And now we're seeing a lot more of kids who are living in the parents' house and being dependent on them. And again, so I was saying, like the recent article that I saw, about 3.3 million and rising And between 2005 to 2010, only 79% of 25-year-old high school graduates have enrolled in college or were employed in civilian jobs or in the military. And this is a great thing, is that 15% of parents who care for these people feel that the caregiver burden is comparable to having a family member with chronic illness. So it can be debilitating for both the parents, especially if they are, getting older, and for the kids themselves. So as I was saying, culturally, like I came from the Philippines, came from Turkey, we, it's accepted to live with our parents, after we become adults, right? But
That's
even
the norm,
so,
right?
but even so, you're expected to be either continuing into higher education, or if not, getting a job, even if you're living in their house and helping out, sort of little bits. But in the US, this is a new and emerging thing. So the causes that looked at, bad economy, the lack of jobs that are available, unwillingness to take on education debt, decline of rites of passages to adulthood. And this is what we've seen a lot in during the isolation due to COVID, and failing frequency of marriage. So people who get, married younger, not being able to cope with the marriage failure. And then challenges are usually, when we see young adults with this kind, usually you see them with anxiety, depression, some with suicidal ideation. And then there are those who are also non-compliant with therapy, either not having the means. So if they're in their houses, they are not able to drive, they don't have their own cars, so they're very dependent on people around them to take them to their appointments. And again, the major thing is, since it's not a valid diagnosis yet, there's still no standard of care. The more emerging thing right now is trying to get the term failure out of the diagnosis, and calling it more as an accommodation trap. So that means there are people who accommodate these young adults, but since they're being accommodated, their basic needs are being fulfilled, and they don't feel the need to get out of the situation. Whereas those who are caring for them feel guilty initially about not giving or not providing enough care. So they provide basic care, they cook food for them, they do laundry, they drive them to their appointments. But then at some point, like a caregiver fatigue sets in, and there could be a struggle to maintain the situation, and it becomes hard to break the pattern. And then eventually there might be a feeling of resentment from the caregivers, and then those who are depending on them feels betrayed that they're not being cared for. So it becomes a very complex situation the longer the situation is not remedied. Do you have any questions? I think that's the end of my slide.
We can actually, yeah, you stop sharing for this too. So I'm gonna learn my other video. So now I do have questions, not question necessarily, but maybe more like comments, and like, what's the root cause of this issue? Like, is it maybe explaining us the generational issues that we have been talking about for a long time? Because, I know people, and I don't want to sound old, but Gen Z is something that we are, complaining about very often. And also, I remember complaining about millennials before this one, but there's something different this time. And now when I was listening to your presentation, and I did some prep, obviously, and I couldn't help but connect these pieces together. So complaints and issues that we have with Gen Z, like this accountability, not being accountable as much. And I'm not generalizing, I'm just, well, actually, I am generalizing, but I'm not saying that this is 100%, but probably 75% of the time, this is what we see. Now, this is impacting even the new generation of workforce that we are having difficulties to hire. So then when you actually came up with this, and I saw that movie when it was in the movie theaters when it came out, and I didn't think about that becoming the new, maybe new trend. Well, maybe that's because, again, as you mentioned earlier, maybe our backgrounds. So it was normal to be in your parents' home until you get married. So,
Yep. Yes.
believe this or not, but I was the first person who moved out of the house, not just from our nuclear family. It's like the entire Erkan family. I was the first person who moved out of the parents' house, and my mom didn't talk to me for about a month. So,
Exactly. Our parents want to keep us in the house, right?
so although in here, when we look at it from this side of the culture, from the Western culture, as you mentioned, like everyone by the time they're 18, they have more financial responsibilities. Like they get part-time jobs. I mean, I don't know how it was in Philippines, but in Turkey, having a part-time job wasn't something common. Like I work for the family. Like even though when I was, well, throughout my youth, younger times, I did work. But it was something that I wanted to do, and I didn't get paid. So, so it was kind of like you have to go with your dad wherever he is. But here, we all have, at least it used to be, everyone has some part-time jobs in high school, and they would have another part-time job in college, and they would help themselves to get out of that financial independency. But now, I guess that's stopped happening. I think that's why maybe we are complaining about this, right? Because now the Gen Z wants us to pay for these, or wants their parents to pay for their entitlements in a way. So, and then that's becoming more and more problem. And I know you have patients, maybe, so this is the freedom that I have. So because you're a physician, I'm not, so that I can say a little bit more than probably you do without worrying about hurting people's feelings. But I do see this as an issue, like, the entitlement and accountability together, it's just like too much entitlement, very little accountability, and they don't really believe that they have to work hard. And I think this is where how we came up with this topic and why it's important for us to talk, because it's being discussed in the exam rooms now, and then you either work with the patients directly on the pediatric side or maybe on the adult side. In the same practice, they are complaining about their kids. So what's the best way to best approach for the parents in this case? Because the patient on the pediatric side may not want to be taking any action, but what's the best action in your opinion that they can take?
Yeah. Well, before I answer that, I also would want to point out that, the effects on the generation is also a little bit different. So, it's still poorly understood how a lot of this social media is affecting them. Of course, the formation of the adolescent mind is still being studied up to now. So, the impact of the things that they have available to them from the younger age is still poorly, the effect of that is still poorly understood. But what they're seeing right now is, again, like going back into that, what I said about the accommodation trap, is trying to be sort of like less accommodating, like like trying to limit, one by one what they can get. So to encourage the young adult to seek out and do something for themselves. And hopefully, if they start something new, they feel good about it and they get out of being there and they try to be independent by themselves. So sort of like, probably a little bridge like to our culture that, you're there, you're inside the house, but you're not entirely dependent. You could start with just, okay, having responsibility about doing chores at home, okay? Not expecting the parent to still cook for you or do your laundry, instead doing it for them. So that can be as basic as that. They don't have to get out of the house, but they have some chores that they need to do. Because some kids, believe me not, there's some kids who are just doing video games like all through the night. They sleep during the day. They don't do anything. And the parents feel helpless.
Well, again, I remember when I called you, I think it was Wednesday night, or was it Tuesday night? When we were kind of just getting ready for this, I was just thinking to see, there are, as you and I, we are about the same age. So in our generation, and again, I see a lot of cultural familiarities between Turkish and Filipino culture. So I'm going to make some assumptions, and if I'm wrong, then you can correct me, please. I don't remember our parents being so crazy about us, throughout the day, for example. Like my mom wouldn't know where we were. Even when we were little, we were out and we were playing and getting in trouble or doing things, and they wouldn't know. The only important thing was we had to be home before dad gets home. So that was the main thing.
Yes.
But they would be happy that we were out and not bothering them, right?
Yes.
So this is when we were kids. So that gives us a lot of accountability because we were able to stay outside and then survive with friends, not being, giving any privilege. So that it didn't matter who you were. So then you had to survive in those situations with other kids. Some of them are a couple of years older than you are. Some of them are younger. But in that group of people, you have to find your way to learn how to actually live your life in the future. So, and I find those very important. And even in the school system, I don't remember. I was a very successful student. I don't remember getting any compliment from any of my teachers. So, and I'm not complaining about that, but it was kind of like it maybe teaches us something more when we are not being always complimented and just being pampered, in a way that this term that we used to have, no kids left behind, right? So everyone has to pass their classes regardless of how bad they are. Well, how and why? And maybe all those things without realizing that was going to be becoming a phenomenon like this. Those things were just playing a part. And all of a sudden we have this new generation of I'm going to work 20 hours, but it's not enough for the things that I'm spending, my expense. It's not enough for my expenses. So I want you to pay my parents, I want you to pay for X, Y, Z, and I'm going to actually stay with you, but I'm not going to be participating in any of the household tasks. And I think that's something that parents probably should really take ownership as well.
That's
I mean,
true.
I used to, and then I would like to hear how it was for you. There was a time where I used to judge my parents, and then that went away because I realized what they were doing was right. Because life is not seeing us in, life is not giving us privileges. So when we are out there, when you're in college, no one knows, no one cares about your last name, how much money you have, or how smart you are, because everyone is very smart in that group, and everyone is coming from X type of family. It doesn't matter. So you have to actually be in that group. And then I realized that what they were doing, what my parents were doing, was the right thing, because that's the real life. So that's why we are able to actually survive and actually become more successful. So you and I, we were born in different countries and we are here and doing this. So what drives us is the upbringing that we have, and that comes from our parents.
True, true. Yeah. Yeah, going back into that, like, the No Child Left Behind is a good concept, but I think there's a lot of like systematic problems that makes it difficult to implement properly. So instead of, empowering the kids who are being about to be left behind, they get pushed along, and, they don't get equipped with the proper things. I mean, again, not generalizing, but this is happening in a lot of school systems. And, I don't think we have enough hours to delve into like the systematic problems that affect it. But, unfortunately, that becomes a problem.
So do you work with our social workers in these situations? Because this requires a lot of follow-up and a lot of conversation, right?
I have referred, I have referred a lot because, again, like, we do have shortages of counselors and, people who can help them. And a lot of times they would need therapy, counseling, because they, being in this situation, they get anxious, they get depressed. So we have to deal with this with the psychological and mental stuff first before we feel that they are okay to move along.
Actually, that was my next question for you. So because depression is the another issue in the young adults and the pediatric population, and it's actually increasing more and more every day. So this probably leads into depression, as you were saying, right? So that's kind of also explain why we have so many people who are struggling with depression, so many young adults. Well, they're all kind of connected to each other. I mean, I find these things very interesting in a way that there's always a reason. It's never by itself. So there are always other factors playing roles in kind of forming where we are today with these issues. Now, without pushing too much, but I do want to kind of transition from this to another topic that's not part of our presentation. And if you are okay with that, I would like to discuss that with you. I read this news last either Tuesday or Wednesday. That was actually the reason that I called you.
That's right. Yes.
That triggered the reason I talked to her first. So this is a woman who transitioned to male at 16 during cardiac time, sues doctor who gave her a double mastectomy. So, and in this show, we discuss the issues around the transgender population, what they're going through, goods and bads. We were openly, because we are looking at it from the independent standpoint, from fairness is the main focus for me. So it has to be fair. Like, I don't personally find Leah Thomas competing against a woman in UPenn swim team. I don't find that fair. On the other hand, I'm working with our state senator, Sarah McBride, who's the first transgender woman in United States taking that position. I work very closely with her because we also understand that every individual deserves equal rights and they have equal opportunities. Everyone should have that. And to do that doesn't mean that we have to be unfair on the other side. And I think like with the Leah Thomas situation, I see that being extreme in a way that it's actually a bad publicity for this topic. However, from the medical practice standpoint, when I see these types of issues, I also look at the liability, malpractice part of it, and now this is happening more often. From the pediatric side, I would like to know what your position is and how we can actually prevent future liabilities in this topic, in this case. Like, so should a 16-year-old have this surgery? Is my first kind of like question. And because after they're adult, it's one thing, but maybe we can start with that. Should a 16-year-old have this surgery, even if their parents are okay with that?
I've been thinking about it since we talk about it, and I don't have the answer. Okay, it is a very, it's something that we cannot generalize. It's a very individualist. It should be a very individualistic assessment and approach. Okay, so we were talking about, you know, the failure to launch and everything in development. Again, I will bring it up again. The adolescent brain is very, very complex, and we don't know what's happening to that yet. You know, before we say, okay, they're not formed prefrontal cortex, they cannot, you know, make decisions without being emotional, all of that stuff. And there's a lot of emerging studies about it. There's actually like, you know, researching into it, you know, I found this adolescent cognitive developmental study that's been ongoing for a decade now, you know, looking at the things that influence them, leading to addiction, you know, all of that stuff. It's still a very poorly understood subject. Now, having said that, I've come across some good experiences so far. Okay, I would say so far, because it's still evolving, it's still ongoing, that have been successful. Okay, and this is through referring them to proper sources who also are thinking about their responsibilities. So first of all, I would want to believe that people who deal with children have the children's well-being in mind. So I, for one, know that the gender clinic at Nemours, whom we refer patients to, have a team of endocrinologists, primary care physicians, social workers, adolescent practitioners who are doing adolescent gynecology, and social workers who try to help these kids, because most of the time when they come to us initially, they're not coming saying that, okay, we want to transform. They're not happy and saying that, okay, I want to be somebody else. Usually there's long drawn problem with depression or anxiety, poor performance in school, poor interaction with the families and their peers, and they could be diagnosed with a lot of things first before they even realize that, you know, they want to be somebody else, or they want to be, you know, a different gender. And we don't take things lightly. So, you know, I would like to think that the specialists who are specializing in this, that the specialists, the doctors who are specializing in this, the professionals who are specializing in this, are going through, not just ticking all the boxes, but, you know, going through everything to make sure that they address the psychological and mental issues, to really think that, you know, the surgery or medical transformation is necessary at that point in their lives.
Oh, I think the issue that I see, Dr. Liquido, so we, especially in this country, the law is really powerful and very strong. again, like I make, and you also made references to our backgrounds. The law is not as strong as it is here back home in Turkey, and I believe in Philippines. I mean, we don't get scared of the police pulling us over. So we know that we are going to be okay. But here, anything can happen.
Yes,
So,
unfortunately.
So like underage drinking, for example, is a big problem. Being caught with drugs is a huge problem. And a lot of people's lives can be ruined. And you can get to the bars unless you are 21 years old, you cannot buy drinks. Some states you cannot buy alcohol on Sundays. Some of our people from our Turkey office, if they are listening, they may be surprised with this, but in Delaware, you cannot buy alcohol on Sundays. And you can buy alcohol only in liquor stores, so you cannot buy it in supermarkets and other places. But in other states, it may be different. So you cannot buy cigarettes if you are under 18.
That's true.
And
yeah.
My issue of and as you know, I'm pretty liberal when it comes to social issues. But this is one that I'm pretty set in stone in a way that unless someone becomes an adult, and the term that you are using, the adolescent brain, which is it's crazy, like, because it's so many people there. We all went through that, and I don't know how we survived, but
I know, right?
And how they can react to certain things, how they deal with stress, how resilient they are.
Sure.
All those things can make it very challenging. And I think this type of a surgery should be put off until they become an adult. So then they want to do it. Let's say if that is, I don't think that's even 18, because what's the difference between a drinking age and smoking age? Why there's one 18 and there's 21, right? So there must be some reason at some point. So I think having this, if they want to do it, fine. I'm not saying that we want to interfere with their choices and how they are going to be happy. But the problem is we don't want them to make this decision when they are not fully developed and complete their development. And because I also wouldn't trust some parents either, because, in order to trust them, they have to be well educated in this topic. They have to be responsible. And we know that a lot of parents out there who are not as responsible. So this is something that should be, I think, off topic until people become adults. So that's my personal take. Now, the other reason I wanted to actually talk about this is because, as you know, we are doing the political series with our state officials who are running for offices, and this issue comes up. And just sometimes, just because it's a popular topic and younger people, they think that this should be happening regardless of the accountability, the liability. They just want to hear certain things. But I want us to be able to deal with difficult questions and also be extremely responsible for making those types of decisions in the society. I'm not talking about our practice at this point. And the kids should be left alone in this issue. And I did spend a lot of time because if you remember this first time Sarah McBride came to the show, it was almost 18 months, maybe it's going to be 2 years almost. And that was eye-opening for me. And again, since then, we are good friends, and now I'm helping her campaign. So this is not about not supporting individuals who are going through what they went through, but when it comes to the kids, that's kind of like off topic. So hopefully, I will be having these discussions with them, and I do want to bring these up and then see where they are and how we can actually shape the society, because it's important. So like the first topic is the result of certain things happen throughout the years. So it didn't just happen overnight. So then when we look from 20 years from now, what we are going to see is going to be important, and that's the decision that we are going to make today. So that's
Sure.
why I take this very seriously. So I know you have patients. You are in the office. Your background is really nice. I know, but I know you are. So and thank you for taking time and then being with us. So I'm sure you'll come back again with different topics. Did you want to say anything before we close the session?
No, I'm just saying that, you know, with it's still a ever evolving topic, especially over the past several years, and you know, the political landscape is also affecting it. So we will see. It's just good that, you know, as you've said, like we can talk about it, that we can, because we care about it, right? So having this conversation, you know, we don't want to say that, okay, we're for this or for that. It's all like because we want to help, and we want to see where we need to go, and we want to be of help because we care for our patients.
We all live in the same society. We want people to be happy, but also we want to take the decisions very seriously if this is going to impact young adults. If they're minor, that makes it like totally different. It becomes
different, yeah, exactly.
So, that's why you know, we are going to be talking about it. So then the right decisions should be made by our state officials and our medical societies, and the parents who are actually they should be there for their kids. But this doesn't mean that kids should do whatever they want to do. So that's the reason that they are being kids. They are being called kids. So hopefully this can reach out to more people, and then we can have more discussions and debates around this. Thank you again.
Thank you.
And we'll be back with Bariatric Friday with Dr. Ergal in 20 minutes. Thanks. Bye-bye.